My name is Mike Tees. I'm a hematologist and lymphoma specialist at Colorado Blood Cancer Institute. I've been at CBCI since 2015, and I focus on the treatment of patients with hematologic disorders. Hematologic disorders includes anything from the blood and the immune system. And we're beginning to see more and more patients with autoimmune disorders too, because some of our therapies can actually be relevant and very effective for patients with autoimmune diseases. I was born in upstate New York and then grew up in Florida, and then have been pretty much everywhere since that time, but have settled in Colorado. I love to ski. I like to stay active. I like to work out, keep my body healthy, keeps my mind healthy. I'm like an avid news junkie, like to read. I didn't think I was going to go into oncology because I never really thought that this would be something that I would be drawn to. However, I actually had some really unique experiences in residency that really drew me to this field, and I haven't looked back since. It's an amazing field, amazing opportunity to help patients in their most difficult time, and also help them perhaps if they don't need treatment. So that's something I think that has been very rewarding in its own respects. Some people ask what my care philosophy is, and I think it sums up pretty easily when I get this question asked to me a lot, which is, what would you do if this was your mother or your father or your brother or your sister or your grandmother or your grandfather? And the reality is that I do think about that almost for every single patient, because sometimes our treatments aren't really the best for everybody, and you have to kind of look at each patient as their own person and their own ability to even process that information that we're giving them on whether or not certain treatments should be best for them or not. And so we spend a lot of time with our patients at our first consultation, which I think is very valuable because it allows us to get to know them, understand how they're responsive to the questions and the discussion that we're having with them. But it does allow myself and my colleagues to really understand truly the patient down to the core as much as we can. And then that allows me to kind of tailor the recommendation to them. So I would say my care philosophy is like family. At CBCI, we truly look at the future of treatment options, and cell therapy and immunotherapeutic options are really truly the future of the field, and it actually goes beyond hematologic disorders as well. So we're beginning to see that the different options that we have available are actually spilling out into the other fields, such as autoimmune disorders. Every day is a new day to provide an opportunity to provide some benefit to a new patient, and we're beginning to see our benefit beyond just hematologic disorders, which is really exciting. What makes CBCI so unique is I think it's not about the physicians and nurse practitioners and PAs, and I think I'm a little bit biased in saying that yes, I think we're very good, but it's not about the providers. It's really about the entire care team. And really that's where that family-like approach comes in even more so than me just treating a patient like they're a family member. It's all the nursing support, it's the psychosocial support, it's even our dietitians, it's care like family.